All right, party people, we are back at it with another question. Let's get it. If I was to give you an elderly woman with a 3-day history of painless rectal bleeding, as well as a history of diabetes and hypertension, she also has a remote history of coronary artery bypass grafting, as well as a normal colonoscopy a year ago. On auscultation, there are no murmurs detected. On screen, you'll see a list of option choices. Please make your selection for what is the most likely cause of her painless rectal bleeding. 3, 2, 1, boom. There it is. Ischemic colitis is the correct answer. Let's run through why it's the correct answer. What you would see in ischemic colitis is blood in the stool with a history of cardiovascular disease. Essentially, it's caused by ischemic ulceration of the bowel wall at the watershed areas. The most common areas is the splenic flexure and the rectosigmoid junction. What is textbook for this is painless bleeding in the elderly with a history of vascular disease. Now, before we move on to the incorrect options, let's just go over the risk factors for atherosclerosis. Please note that diabetes is the most acceleratory factor. Please know that smoking is the second most acceleratory factor, and that hypertension is the most common risk factor for atherosclerosis. This patient had diabetes and hypertension, but was not a smoker. So please keep that in mind. Now let's run through the other ones, seeing why the incorrect options were incorrect. So, starting with chronic mesenteric ischemia. It normally presents with abdominal pain 1 to 2 hours after eating. This is due to atherosclerosis of the superior or inferior mesenteric artery. It can mimic duodenal ulcer, but usually occurs in patients with significant cardiovascular history. So if the vignette gives you lots of vascular risk factors and postprandial abdominal pain, think chronic mesenteric ischemia. Next up, acute mesenteric ischemia. So there are 3 classic presentations for acute mesenteric ischemia. Let's start with acute on chronic. Here, the patient will have chronic mesenteric ischemia, which develops sudden, severe abdominal pain out of proportion to the physical exam. This is due to plaque rupture and arterial occlusion. Next, we could have a thromboembolic situation where in patients with AFib, and this is often due to hyperthyroidism or a previously known arrhythmia, a mural thrombus embolizes to the superior mesenteric artery or the inferior mesenteric artery, causing pain out of proportion to the exam. And thirdly, post-cardioversion acute mesenteric ischemia. Here, someone recently cardioverted, likely had a mural thrombi that embolized after the cardioversion is completed. All of these require angiography for diagnosis. However, since this particular patient had painless rectal bleeding, they do not apply. Next up, angiodysplasia. This does cause painless rectal bleeding in the elderly and is the 3rd most common cause after diverticular bleed and colorectal cancer. However, angiodysplasia is often associated with aortic stenosis. Think Hayes syndrome. The USMLE tends to mention an elderly male with a murmur or openly or clearly states a history of aortic stenosis as well as rectal bleeding. In this vignette, there was no mention of murmur. This would kind of go against the concept of angiodysplasia. Now, as far as colorectal adenocarcinoma, this would be unlikely. Is it possible? Sure. However, we have to go with the most likely, most probable option, and that would not be colorectal cancer because a colonoscopy was done about a year ago. Is it possible? Sure, but it would be unlikely, especially in light of the major cardiovascular comorbidities. Now, a common mistake that can be made is the concept of chronic mesenteric ischemia versus ischemic colitis. Just remember that chronic mesenteric ischemia is postprandial abdominal pain in patients with vascular history, whereas ischemic colitis is a lower GI bleed due to mucosal ischemia in the watershed zones. And for this patient, ischemic colitis is the better fit. All right, that's it for this one. Go crush it.